Assalamu alaikum. Today's article is titled Instrumentation Kinematics Does Not Affect Bacterial Reduction, Postoperative Pain, and Flare-Ups. It's a randomized clinical trial conducted by Plotino and an Egyptian group. It was published in 2022 in International Endodontic Journal. During root canal preparation, dentine chips, pulp tissue, microorganisms, and/or irrigants may be extruded into the periapical tissue, which may potentially cause postoperative complications, and a systematic review of the literature suggested that this extrusion is influenced by instrument kinematics. However, evidence is still conflicting. Thus, the research question of this study was to assess the amount of bacterial reduction and the incidence of postoperative pain and flare-ups after using single-file systems with different kinematics, either reciprocation or rotation, to prepare single-rooted mandibular premolars with asymptomatic apical periodontitis. The study was designed as a prospective parallel randomized clinical study with an allocation ratio of 1:1. A sample size calculation was done, and the minimum required sample size was found to be 24 cases in each group. The eligibility criteria: patients who participated in the trial were allocated from the outpatient clinic of the endodontic department in University of Ain Shams in Cairo, Egypt, between August 1st, 2020 and March 1st, 2021. Inclusion criteria were healthy males and females aged 21 to 49 years, presenting with a single-rooted mandibular premolar with asymptomatic apical periodontitis, and the randomization was done using a computer-generated randomization. As for the clinical procedure, a single endodontist with more than 10 years of clinical experience completed all the clinical procedures. A 4% articaine hydrochloride with 1 to 200,000 epinephrine was used for anesthesia, and the pre-instrumentation bacterial sampling was performed with the use of paper point after preparation of the access cavity and localization of root canal orifice. And then the cleaning and shaping procedure was done. Patients assigned to the Wave 1 Gold group were treated using the medium file of the Wave 1 Gold system as a single file, and the One-Shape group were treated using the One-Shape file also as a single file. And then after completing the instrumentation, a post-instrumentation bacterial sampling was also taken from the canals with the use of paper point as described previously. And then the root canal filling and coronal restoration was done. And for the outcome assessment, culturing was done and the colony forming units were visually quantified. DNA extraction and the quantitative real-time polymerase chain reaction analysis was also done. And the assessment of postoperative pain and incidence of flare-up was assessed at 24, 48, and 72 hours following treatment using a visual analog scale. Flare-up was defined to patient as the development of swelling after treatment and was recorded as a binary outcome represented by yes or no. And a phone call was made every day for 3 days to obtain information about postoperative pain and the development of flare-ups. Now moving to the results, 66 participants were eligible for this trial and were randomly assigned to the treatment groups. There were no difference in age, gender, nor the treated tooth among the participants in the study group. And all sterility control samples yielded a negative culture. No paresthesia or adverse effects were associated with the use of articaine in this trial. And the obturation quality was assessed by 3 blinded experienced operators within the endodontic department and was considered as adequate for cases. And for the comparison between counts before and after instrumentation, a significant decrease in the percentage of bacterial reduction after using either rotation or reciprocation kinematics. However, the difference between the Wave 1 Gold or One-Shape files was statistically non-significant. And the intragroup comparisons showed a significant reduction in postoperative pain with time for both groups, and the intergroup comparison showed that the difference in postoperative pain after the use of either Wave 1 Gold or One-Shape file was statistically non-significant. And also, no incidence of severe pain necessitating the intake of an analgesic was reported, except for only 3 patients, 2 in the Wave 1 Gold group, which represents 6%, and 1 in the One-Shape group, which represents 3%, had flare-ups, and this was statistically non-significant. This study is presented with several limitations, such as it includes using single-rooted and single canal teeth only, and the further studies should evaluate evaluate if the effectiveness of bacterial reduction in more anatomically complex teeth might have been different. Moreover, the sampling technique, as paper points can only collect samples from the main root canal system. And finally, there is also a limitation when evaluating postoperative pain, such as definition of pain and flare-ups, pain threshold, response to pain, and pain measurement. Therefore, a split mouth design would eliminate such inter-subject variabilities. And to conclude their findings under the present clinical trial conditions, there was no difference in the bacterial reduction or incidence of postoperative pain and flare-ups when reciprocation or continuous rotation motions were used during root canal preparation of single-rooted premolars with asymptomatic apical periodontitis.